So today we are going to be doing sterile gloving. Sterile gloving is a hugely important part of nursing and healthcare because doing procedures, invasive procedures such as placing a urinary catheter or changing a central line dressing or a dressing that has been ordered to be changed sterilely. It's very, very important because you want to protect that patient and their health. And it's important in the field or during an apocalypse, I don't know, just anything. Being sterile is so specific, and then maintaining clean procedure just in general in the field is just huge. It's massive because you don't want any microbes affecting that patient's health, especially with invasive procedures or cleaning or anything like that. So one of the foundations and fundamentals in nursing is sterile gloving. So this is a pair of sterile gloves that I actually have. So basically, one of the first guidelines of sterile is when you're applying your gloves, you want to apply it to your dominant hand first. So I am right-handed. So when I apply my gloves, I'll be using my left hand to place my sterile glove on my right hand first. And the reason that you're applying it to your dominant hand first is because it takes a little bit more skill to maintain sterile here. Once you have this glove on, you're sterile. So you have to remain sterile and also place a sterile glove onto your non-dominant hand. And that takes a little bit of skill. So it's safer and more likely that you're going to maintain sterile if you apply it to your dominant hand first because, you know, you're a little bit more well, you know, your fine motor skills are better on your dominant side. So also 1 inch border. So within the sterile field, you have a 1 inch border. So everything that is around your 1 inch, around your sterile field, the last inch, that would be available for you to make non-sterile. So not more than an inch, less than an inch, fine, whatever you want to do, but you have about an inch or so to remain non-sterile. And that way you can, you know, work, you know, move your sterile field however you deem necessary in order to maintain sterile. Something else about sterile is if this is your sterile field, if you reach across your sterile field with a sterile glove like this right here is okay. But if you're going across your sterile field, you know, whatever skin or, you know, hair that might be sitting here on my arm or my clothes or whatever falls into the sterile field, even if it's microscopic and you can't see it, doesn't matter. You've broken sterile. Your whole field is contaminated. So don't cross your sterile field. Sterile, you must always be able to see your sterile field. So your sterile field must remain in front of you. If it's on a rotating table, like such as we see in the hospital, you can use your foot to kind of maneuver with, you can place your foot on the bottom rail of the table and kind of use your foot to maneuver your sterile field to remain in front of you no matter where you're turning. But you must be able to have that field in the line of view. And with that being said, once your hands are sterile, you must be able to see them. If you put this hand over here, you are no longer sterile here. I mean, you'd still be sterile over here, but good luck, you know, doing whatever, finishing whatever sterile with your one hand or non-dominant hand or whatever you have left. At that point, you would just, you know, remake yourself sterile. Something else is because you must have your sterile field in view, your hands must be above your waist at all times. So if you put your hands down for like a minute below your waistline, below your pelvis here, you are no longer sterile. So those are just initial guidelines for sterile field. So now we get to the actual sterile gloving. Sorry, that took a little minute, but it's important to explain those things because it's important. I mean, it's valid to remaining sterile. So I'm gonna go ahead and do it real quick and show you guys, and then I'll do like a smaller or like more teaching version after I do it. So first I'm just unfolding. The inside of this package is sterile, while the outside is not sterile. And, you know, I'll just run through it and kind of explain as I'm doing it. So I would open it up, again, inside the sterile. So you have these two flaps, one here on this side and one here on this side, that you can open your field with. The inside is sterile, the outside is not. Once you open these flaps, these parts right here, although still sterile, they're not, because if that flap comes back and accidentally folds back onto your glove, which does happen, so you'll learn like to really unfold your paper very carefully, and you'll get better at that the more and more you do it, and it becomes fairly easy. But if that paper falls back onto your sterile glove, it is no longer sterile. You cannot use that glove, and it's just easier to get a whole new pack of gloves, which is just an absolute waste of product and your time and the patient's time and so forth. So you'll learn to unfold these very, very carefully. So I'm going to unfold. So what I do is I grab up here at the top, and then usually my habit is with my right hand, like I kind of pull down because it's like a whole flap, and this allows me to open from one side to the other, and then from left to right, and kind of from top to bottom. You can't really see. I'm sorry. Still can't really see all of it. So don't lean over your sterile field. Great. Okay. So there's my dog. So you would, I'm pulling apart on either side from top to bottom, and then I hold my paper here, and I slide from top to bottom, and just pull this again to make sure that like it's unfolded appropriately, and none of these will fold back onto my gloves, because if that happens, they're no longer sterile. So my fan is kind of blowing, so it's not really working in this environment. Okay, that'll work. So now I'm gonna do my dominant hand first. So I'm going to pick up the edge of the glove here. They're folded in, so you can touch this part that's cuffed, but not any other part of the glove. So I'm gonna look and see kind of where my pinky is located, where the thumb would be located, because I wanna match it up. It's like a mirror image, so it'll kind of be reversed from that side to this side when you're looking at your hand. But a good rule is to hold your hand palm facing in front of you. That way, like it'll work out like when you go in. So I'm going to take my fingers here and just kind of, again, touching the inside of the cusp, because the inside is not sterile. Obviously, once you put your hand in, it's not sterile. So you can touch the inside, and that opens the slit of the glove. Now I'm going to take my fingers and really put them together, and that prevents me from touching anywhere outside the glove. When I collapse them, keep all hands and feet inside the aircraft at all times. Essentially, it's the same concept, like you're holding them in, and then you're less likely to have any problems as a result. So I'm gonna hold right here, and I have my hands above my waist. I'm gonna slip my hand inside, and then I'm gonna hold the glove up. Take your time, especially like the first few times you're doing this. Take your time when you're applying sterile gloves, no matter how many times you've done it. I mean, it takes a minute, but you get faster and faster. It gets a lot easier and easier, but especially when you're beginning, take the time to really focus on what you're doing and watch yourself and hold yourself accountable. That's one of the primary things in sterile field to begin with, is holding yourself accountable. That's kind of what it comes down to. So I'm again holding the cusp of the glove, and I'm pulling on the outside. And once I've kind of got it on appropriately, now it is kind of folded. The cusp here is still kind of folded, but that's okay. I'm not worried about it. My glove is on. I can work, and I have the dexterity and the capacity and ability to pick things up and move around with this hand like it is. So it's completely fine. You're gonna have that. You don't have to try to straighten it out and make it like a regular, perfect, even glove. Because you're more than likely going to break sterile if you do that, because we make mistakes. So the more, keep your hands and feet inside the aircraft at all times. The more cautious you are, the more likely you are to succeed, essentially. So now this hand is sterile. This hand is not. I have to use this sterile hand to apply sterile application to this non-dominant hand, and I can't break sterile over here. And then as I'm applying the glove, I also can't break sterile to this new glove while I'm applying it, or anywhere else for that matter. So this hand is sterile, and it means it can touch anywhere in this field, and I am not breaking sterile, and that's fine. So I'm going to lift this glove up here, and again, like, I'm grabbing it by the cusp because that's just the easiest way to do it. I'm going to hold my palm to my face. I'm going to kind of look and see, all right, where's my thumb, where's my pinky, and it is possible to accidentally get it backwards and be able to flip it around, but again, that takes more time, and then you're more likely to break sterile. So just be careful. Try to get a view of like where the thumb is kind of supposed to be. The gloves kind of generally come lying with 4 fingers out and the thumb kind of on top, as if like the hands were like this. So just kind of generally that's how they come. Sometimes they don't come like that, but generally they come like that. So it's kind of easy to see like which angle you should apply it to, and that'll prevent you from breaking sterile. So again, I'm going to cusp my fingers, hold them all in. This flap is kind of open for me already, so I'm going to go ahead and insert my hand, and I'm pulling from top to bottom. All right, don't want to, oh, there goes that sterile field right there. So I'm going to just push that out of the way. Haven't broken sterile. These 2 hands still in my line of view. Even if you can't see them, I can see them, so they are still sterile. So I can, if I don't kind of like the position, be careful with doing this, but again, like, you can kind of pull or move around, like, or for instance, like if this happens a lot, especially like when we all first started sterile gloving, where like you'll get 2 fingers inside of the same pouch, and it's like, well, wait, like once I pull that through, like that's not gonna work. That's, you got this one like flipping around right here, that's not gonna work. So this hand is sterile, this glove is sterile. You can now maneuver and like pull this out and try to fit your hand and fit your finger where it needs to be. And then once you do that, you can always pull. Sterile to sterile is always fine. And then just make sure you don't touch this cusp again, because I had already, that's no longer sterile. So if it breaks, of course, if it splits even in some small capacity, it's not sterile. So now a good way to do it to help with application is to kind of take your hands and fold them intertwined, and kind of really hold like really tight. And what that kind of does is it kind of like pushes whatever remnants of separation is kind of there. It kind of pushes it down, and that decreases the length up here, which will kind of help with your dexterity when you're working a little bit, and of course also help prevent you from further breaking sterile. So that's pretty much it, the basics of what a kind of sterile field, and how to apply sterile gloves. And so now I'm going to break sterile and see you guys later. Bye.